Kennestone Command Center. Go ahead, Metro.
Kennestone, we're currently in route to your facility with a 16-year-old male patient, restrained passenger in a rollover MVC that landed on the passenger side of the vehicle. Patient was extricated.
The golden hour, a brief window of time in which the lives of a majority of critically injured trauma patients can be saved if definitive treatment is provided within 60 minutes from the moment of injury. Trauma is the leading cause of death in the first 4 decades of life and is the third leading cause of death overall. Every year in the United States, nearly 3 million people are hospitalized and close to 200,000 people die from traumatic injuries.
ETA is 5 minutes.
Metro clear. Tier 1 trauma, room 1, ETA 5 minutes. Tier 1 trauma, room 1, ETA 5 minutes. Zone A, KEG to respond. Zone A, KEG to respond.
Okay, thank you. We have a Tier 1 trauma.
Ancillary departments, such as the blood bank, provide support to the trauma response team. The Wellstar Kennestone Trauma Center developed a massive transfusion protocol to facilitate the administration of multiple blood products to critically injured trauma patients.
We got a 16-year-old male MVC rollover, extrication, confused, GCS of 13, blood pressure 88/58, heart rate in the 130.
All right, let's get some fluids ready.
Frequently, multiple trauma patients require immediate life-saving interventions. Crucial decisions are made with little time for deliberation. Care must be organized and precise. There are no opportunities for second chances.
You want pharmacy for RSI?
Yeah, we're gonna ice that out.
ICU is here. I have a blood here.
All right, what's the story?
A 16-year-old male patient involved in MVC rollover. He was a passenger. We have an IV established. Also have a non-rebreather. Have traction on his right leg.
1, 2, 3.
The trauma response team also utilizes advanced trauma life support processes for the initial evaluation and resuscitation of the trauma patient.
20 Vitamin.
Blood pressure cycling.
Good bilateral breath sounds.
Keep blood pressure.
Blood.
Yep, let's get IVs.
Give him 2 units of O-negative blood, please. How are his pulses down there?
+1.
No chest wall crepitus.
I got a liter of warm fluid.
Abdomen is soft. Pelvis is stable. He does have a deformed right femur.
Has been an accident.
Mrs. Johnson, my name is Carrie. I'm one of the care coordinators. We just want to hear
That's him.
To provide holistic care to our patients and their families, care coordinators and hospital chaplains are members of the trauma response team.
So what we're going to do is while they're getting x-rays and everything, I'm going to have you wait in this waiting room. And then when he goes by his CAT scan, we're going to see him as he goes right by this door. Okay? CAT scan's going to take about 20 minutes.
The Wellstar Kennestone Trauma Center utilizes a multitude of diagnostic tools, including X-rays, CT scans, MRIs, and angiography to identify injuries.
It'll be okay.
CT scans are a highly reliable, less invasive diagnostic tool that allows our trauma surgeons to identify specific organ injuries.
Okay, there's active bleeding. We need to go to the OR.
Many trauma patients require emergent surgeries to control bleeding and repair injuries. Some will need progressive operations over time for repair and reconstruction. The Wellstar Kennestone Trauma Center has operating rooms immediately available 24 hours a day, 365 days a year. Trauma surgeons provide families with regular updates regarding the care of their loved one. Their questions are answered while emotional and spiritual support is offered.
2, 3.
Our dedicated trauma surgical ICU receives critically injured patients from the ED or the OR. Trauma surgeons, advanced practice providers, and trained trauma nurses are available 24 hours a day to manage the critical care needs of the patients.
Hi, how are y'all doing? So his injuries were very severe.
Our patients' friends and family members regularly participate in care planning with a trauma team. The Wellstar Kennestone Trauma Center also facilitates a weekly support group for trauma victims and their families. On the Trauma Surgical Acute Care Unit, patients continue to recover from their injuries. Nutrition and food services provide healthy meal options that promote wound healing. Rehabilitation includes physical, occupational, and speech therapy. Wellstar Kennestone Hospital has an inpatient rehabilitation unit for patients who require intensive rehab prior to discharge. Patients must be able to participate in at least 3 hours of therapy daily. Our goal is to return patients to their families and reintegrate them into society. However, some lives are forever changed as a result of injury. The Trauma Center's Injury Prevention Program aims to reduce the risk of traumatic events through outreach, education, and awareness.